The time has come to stop ignoring the mentally ill in this country.
On the campaign trail, Governor John Kasich boasts about how he's helped the mentally ill. But when 5 on Your Side investigators reviewed how Ohio funds local programs, we uncovered a serious flaw.
And Lee, that flaw hurts people right here in Cuyahoga County. Investigator Sarah Buddison, we are getting less money than other counties.
Danita and Lee, 1 in 4 people suffers from a mental illness. And while Ohio may be doing more than some states to help, our investigation found dollars for critical services aren't making their way here.
I remember at one point I was in so much pain that nothing was funny.
This is a peer support group.
I've never found a place where I felt I belong.
One of many held at the Life Exchange Center on Cleveland's east side.
Come on, Katrina. You're gonna have me crying, girl.
Every person here suffers from a mental illness.
Since I've been here, they brought me a lot of joy.
Including the woman running it.
I can say I've been there. I've done that. The drugs, domestic violence, all of it. The drinking, the partying, the depression. I have been through it all.
At just 13, Crystal Owens was diagnosed with bipolar disorder and schizophrenia.
I think that they really think I'm helping them. They are helping me.
But since I've been coming here, I have my life back.
Deborah West's depression was once so severe she tried to commit suicide. She says the center's services, like art therapy, literally keep her alive.
Just like taking a breath of air to make me breathe. That's how important it is to me.
The mentally ill, they've been stepped on for too long in this society.
In debates,
I've worn out more shoes knocking on doors.
And on the campaign trail, Ohio Governor John Kasich often claims he has come to the rescue of the mentally ill by expanding Medicaid. After all, it's led to more than 600,000 Ohioans being enrolled in the federal program, which covers the cost of treatment and prescriptions for mental illnesses.
When I study scripture, I know that people who live in the shadows need to have a chance.
The funding for Medicaid isn't the only thing that a person needs.
But Bill Dunahan says it's not that simple. He runs Cuyahoga County's Alcohol, Drug Addiction, and Mental Health Services Board and says services like housing, job training,
It's been a blessing to be here.
and support groups matter just as much.
How important are those services that you just listed?
Well, they save lives. That's how important they are.
So you'd think the services would be well funded, especially in Cuyahoga, the largest county in the state. But when NewsChannel5 investigators reviewed the numbers, we found we're seriously shortchanged.
We should get close to $6 million. We get $405,000.
Out of Ohio's 88 counties, Cuyahoga receives the least amount per person. Even more troubling, out of a $128 million mental health and addiction fund, the state gives Cuyahoga 7% of the money, even though the county makes up 11% of the population.
That's wrong. That's blatantly wrong, and it continues to happen. If we don't have the funding to take care when they're mild or moderately ill, they become really ill and cost us more money.
I hear voices.
Like what happened to Jeffrey Marshall.
I get signals from the television and the radio and things like that.
He's been hospitalized at least 10 times because of his schizophrenia. Hospitalizations that can cost up to $600 a day.
Sometimes you be kind of like demon, you feel like you're demon possessed and things like that.
So why isn't Ohio giving Cuyahoga County more money? We wanted to ask this woman. Tracy Pluck is the director of the Department of Mental Health and Addiction Services.
That's how you win elections.
Appointed by Governor Kasich, she decides how to divvy up tax dollars to Ohio's counties.
My name is Sarah. I'm with NewsChannel5 in Cleveland.
But we didn't get far when we visited her Columbus office.
We wanted to talk to Tracy about mental health funding in Cuyahoga County.
Yes, unfortunately she's unavailable, but you're welcome to send an email.
She did send us a statement. It didn't explain her decisions, but it did say she is, quote, open to discussions on changes.
We don't play about our recovery here.
Changes Crystal hopes she makes.
We need something here to keep people out of trouble, to keep people having hope, to keep people happy, to keep people strong.
We reached out to Governor Kasich's office. A spokesperson sent us a statement saying they too are open to a change,
But the priority has been the Medicaid expansion. They say 15,000 previously uninsured Cuyahoga residents who needed mental health and addiction treatments now have coverage. On your side, I'm investigator Sarah Buttison, News Channel 5.